The Health Office of Gunungkidul Regency, Special Region of Yogyakarta, corrected the information about the number of people who were confirmed to have died from anthrax in Candirejo district. The death of 3 residents in Gunungkidul, Special Region of Yogyakarta after consuming beef which died due to anthrax disease in Gunungkidul, Special Region of Yogyakarta, indicates that the One Health approach has not been implemented properly. This case could have been prevented if consistent surveillance of zoonotic livestock diseases had been conducted and education provided to the community. The case of anthrax in humans in Indonesia is a recurring incident, usually starting from sick and dead cattle whose meat is then consumed. That is almost always the trigger, said Chandra Yoga Aditama, professor at the Faculty of Medicine, University of Indonesia and former Director General of Disease Control, Ministry of Health, on Wednesday. It was previously reported, according to the Health Ministry's data, that 3 people had died of anthrax. But after further investigation, it was discovered that only 1 had been confirmed to have died because of anthrax, based on laboratory tests at Dr. Sarjito Central General Hospital. One of the 3 people who died has been identified as a suspect, while the other 2 died with symptoms of anthrax. The Ministry of Health, according to Nadia, will further confirm this case, including conducting epidemiological investigations on where the case originated. Based on tracing and asking information from the residents of Samanu, only 1 died of anthrax, Gunungkidul Health Office's head of disease prevention and control Sidig Heri Sukoko said on Wednesday, July 5, as reported by Antara. This information was also corroborated by the Vice-Regent of Gunungkidul, Heri Susanto. It was said that 2 other people who died had also consumed beef from a cow that was indicated to have had anthrax. However, their bodies have not been tested for anthrax. The person who died of anthrax was a resident of Padukuhan Jati, Candirejo village. The deceased was treated at Dr. Sarjito General Hospital on June 1 and died 3 days later, Sidig said. Upon hearing of the death, a team from Gunungkidul Health Office visited the Padukuhan Jati to examine the residents and found 87 as seropositive for anthrax, meaning they had been exposed to anthrax, but they did not show clinical symptoms. People who are seropositive anthrax, Sidig said, have a chance to recover because they now have antibodies. The 87 residents are asymptomatic, we have also given them treatment, he said. Chandra said, anthrax is a contagious animal disease caused by the bacterium Bacillus anthracis. This disease generally attacks herbivorous animals such as cows, goats, sheep, and others. Because it is zoonotic, this disease can be transmitted from animals to humans. The bacteria that cause anthrax, when exposed to air, will form highly resistant spores against environmental conditions and chemicals including certain disinfectants and can survive in the soil, hence why anthrax is sometimes called the soil disease, he said. Chandra added that because anthrax is a zoonosis and even exists in the soil, then its handling must be through the One Health approach, which is a joint effort between human health, animal health and environmental health. The responsibility is cross-ministerial and should be coordinated by the Coordinating Ministry for Human Development and Culture of Indonesia, he said. Anthrax cases have been reported for the past 4 years in Gunungkidul, specifically in 2019, 2020, and early 2022. The first suspected anthrax case was experienced by residents of Jati Hamlet, Candirejo Village, Samanu District, Gunungkidul on June 2, 2023. The Waits Grand Veterinary Office also received soil samples from the location of suspected anthrax livestock deaths on June 15, 2023, and the laboratory test results showed positive for anthrax on the soil samples taken. Jadra stated that if surveillance of livestock finds the presence of zoonotic diseases such as anthrax, human and soil health should also be surveyed. The risk of transmission to humans, including anthrax spores in the soil, needs to be checked. Don't wait for cases to occur in people, he said. According to Chandra, a case of anthrax occurred in Maros in 2010. It started with 5 cows that died within 2 weeks in March 2010, one of which was slaughtered while sick and its meat was distributed, triggering transmission within the community. According to test results from the veterinary center on March 29, 2010, the cows were positively infected with anthrax. Meanwhile, the anthrax outbreak in Boyolali in 2011 began with the chronology of the spread of the disease from a sick cow at the end of January 2011. The owner of the cow slaughtered it for personal consumption of the meat, and some of it was sold at the market. The experience in Maros and Boyolali shows the transmission of anthrax from sick animals which are then slaughtered and consumed by humans, something that needs to be made clear to the wider community so that incidents and even deaths in humans are not repeated like in Gunungkidul today, said he. Global health expert from Griffith University, Diki Budiman, stated that Indonesia is a country that is very vulnerable to various zoonotic outbreaks, including anthrax. The One Health approach in Indonesia so far is still at the level of concept and policy. How the detailed implementation of human and animal health still needs to be worked out. This requires cross-sectoral coordination, he said. According to Diki, the anthrax cases that have caused casualties in Indonesia indicate the weak coordination among agencies in preventing potential zoonotic outbreaks. A similar situation has occurred with rabies, which remains an epidemic in several regions in Indonesia. Thanks for watching.